Combo, ding 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 ding. Now, time to do what I usually do, like oh, I have to do something. There is something I not done. This one here. Yes, yeah. There is Sorry guys, I was setting up one, two, three things, and there was a request that I talk about something called hives. So this is the thing. So I need to go to I have to go to where? No, I have to add a tab. Yes, I have to add a tab. I have to add a tab, and then I do what? I click on this one. So that's it. Hi, baby, Jen. Aye, Amankombo, Awala, Sakombo, Amankombo, Ahi, baby, Jen. What was I doing? Yes, guys, welcome to this platform right now. Emphasis Lipenga, welcome. This is a late night. Here it is at 10, imagine. At 10. I want to talk about a very quick topic before I sleep. Before people sleep, not I sleep, because I'm always working. Now it's at 10, 10 sharp. Imagine 10 sharp, and I'm still here working, and I was in the hospital. Now, FRC Penga. Which county are you in, or which county are you in? Yeah, hi. I'm here to talk about something that someone requested, and someone requested I talk about allergic reaction. You see, this person didn't know. She was asking me to talk about allergic reaction, but she told me she usually has something called hives. So hives are allergic reactions. Hives are allergic reactions, and we're going to talk about hives. We're going to talk about hives and many other. There is someone when I'm online, my friend, a very good friend, and he likes me to call him and tell him that I'm online. So we are talking about hives today. Allergic reactions. What brings allergic reactions? what brings allergic reactions. So that is our topic of the day, and we must really. Many people say that I have allergy. Let's get to know what allergy. When you say you have allergies, what can you do to prevent allergies, and what can you do to make yourself away from allergens? Because some allergies makes you, yes, anger. I've been receiving requests to talk about something called allergic reaction, so I'm doing it right now shortly. It's okay, no problem, no problem. We'll talk. Yes, yes, yes. It's okay. No problem. Let. Yes, yes, yes. Okay. Well, now we talk about allergic reactions. What are allergic reactions? You see, uh, allergic reactions are reactions that cause some things that happens in your body, like rashes. When and how does these rashes come on your body? How do you get rashes in your body, or how do you get an allergy? That is our main focus. And how do you treat? I will say allergic reaction in your body is something as it is like a protective nature of your body to help you not to suffer from other things. Now, when we talk about hives, hives are raised, itchy swellings on the skin that can appear suddenly and move around the body. Some itchy, I don't know if I can get a picture of, let me get a picture of hives so that people can know allergic hives, allergic reaction body, so that people can look at the picture and see um, what we are talking about. Hives. You know, sometimes you may have some issues. Which one? Which one? Skin disease. Let me use this one. It's that people can say, yes. Let me use that one. You see, when you are seeing a picture, at times you may appreciate what I'm talking about, because most of the time when you hear about medical terms, people, when they hear medical terms, they say that one I cannot be part of it because it is so hard. Some things are not hard in medical field. It's just that the names are hard. Now I want to show you what hives are and the allergic reactions. Let me see if this picture is here. Where are you, Mr. Picture? Hey, I'm not seeing that picture. Let me see. Let me see, where is this picture? Oh, I've seen it. This one. The picture that is coming on the screen, the picture that you want to see right now, is a picture of an allergic reaction. If you have ever got such things that are coming, let me show you the picture of allergic reaction, and that one. No, let me put it aside. A bit aside. Let me put it here. Now look at that. Look at that. Those are called allergic reactions. Let me do it again. Those are called allergic reactions. They are called hives. If you take drugs, food that you are allergic to, and some things that you need you don't your body does not go well with, those are things that you get. Those are things that you get. They are called hives. At times, now that is a layman's language. For a person who is a medic, I will not call that those hives. I'll call them articaria. Articaria. Let me post that one so that people can we live in a world whereby the society right now, you cannot just lie to someone even if you are educated. People will go online and they will Google and they will know the real thing. So let me give you that word so that where you are, you can go and check out what is Articaria. But if you have a message and you are listening to me, please come through, my people. Now, the picture that you have just seen on the screen, the picture that you are seeing on the screen of bumps, it is called Articaria. It is called Articaria. Now, there are some people who really suffer from this reaction. This reaction immediately after they eat certain foods or at immediately when they take certain drugs. Eh? Well, let's see if allergic reactions that we are talking about, if they have drugs that you can take to heal you never to get them again, or if there are drugs that you can take and then they just disappear but they can come again. Now, let's see, they may be red in the skin or skin colored. Now, you see, uh, have you ever got that reaction, my guys? Anyone who is in the platform, if you have ever, Gabriel Mwau is here. Welcome, Gabriel Mwau. Have you ever got an allergic reaction from a drug, anything? Someone told me we discuss about hives. Hives is a normal language to other people, but as medics we call them Articaria. We call them Articaria. Articaria. Now, how does this thing come about? Hmm? They are often itchy. You feel like scratching your skin every time. You feel like scratching your skin. How does these things come about? Hmm? They are so itchy, burning sensation, can change shape and location within hours. Right now, they can be on your chin, sometimes they can be on your belly. Why? Usually caused by allergic or immune reaction. Yeah? The highs happen. I want you to listen to this, my people, my friends, my community, my good loving followers. Hives come because of allergic reaction, and the main reaction of hives is a certain chemical that is called histamine. Histamine. Histamine is a problem when it comes to allergic reaction. Thanks a lot, Gabriel Moore. Thanks a lot for telling me that. But if you have ever had an allergic reaction, let's not talk about hives. If you have ever had allergic reaction, raise your hand. Let's see how you dealt with it. Let's see how you really worked upon these hives that we are talking about. Now, allergic reactions that comes because of histamine, they are called hives, urticaria. You have seen that picture that I've just run there. You see, the histamine I'm looking for a good word to demonstrate. Histamine is a gas. Histamine is a gas that is released to your body when some cells are reacting to make your it is a body defense mechanism. And how does this histamine, when you are going to the drugstore, wait a minute, when you are going to a drugstore and you have an allergy, and then the doctor or the pharmacist tells you that you should be having, you should take something called antihistamine. What does this person say? What does this person mean? What does this person mean? We need to know what is histamine as we continue. Histamine is a chemical mediator involved in allergic reaction. It causes inflammation, gastric acid secretion, and neurotransmitter in the brain. You get it? And where is histamine coming from? Because this is histamine. When you are saying that I just went to the pharmacy and the pharmacist gave me an antihistamine. Today we want to know, why were you given an antihistamine? Hives, no, I'm talking about histamine that brings hives. Where is histamine produced? Histamine is produced mainly in the mast cells. There are some cells in your body that are called mast cells, in tissues like skin, lungs, and the gut. Yeah? In the abdomen, in the skin, and around the chest, there are some cells of your body that are called mast cells that they produce histamine. There are some cells that are called basophils. Basophils are some cells in your body, a type of white blood cell in your blood. You see, white cells are many. Yeah? We have T cells, eosinophils. So I'm giving you those ones that produce this chemical that is called, sorry about that. This chemical that is called histamine, that you usually go to the pharmacy and then you say, I have a flu, I need an antihistamine. There is another cell that is called an enterochromaffin like cell in the stomach. Anytime you hear entero, you know it is a cell that is in the stomach. They produce this gas. There is neurons in the brain, some neurons in the brain that produce the same cell. Wow. Aphasia recovery is here. Aphasia, welcome to the platform. We are talking about allergic reactions, and I'm explaining how they come. Allergic reactions come because of some cells that produce something called histamine. And this histamine, it causes you feel burning sensation, swelling on your skin. The swelling like the one that I've shown you, this swelling. They produce swellings like those ones. It is the work of that chemical. So these cells, one of it called enterochromaffin in your stomach, neuron cells of the brain, mast cells in tissues like the skin, lungs, and gut. These are cells that are in your body. And there is basophils, a type of white blood cells that in your blood. They produce this histamine. And how does histamine come about? These cells don't just wake up and then they say, let's start producing histamine. Let's start producing. We want to defend the body. No. Your stomach has a protective guard, a cell called enterochromaffin-like cell that take care, like a watchman in the stomach. When there is a problem, they wake up to tell your body there is a problem in your stomach. Enterochromaffin-like cell. There is another one called basophil, a type of white blood cells that walk in your blood. When they see there is a new thing in your blood, they wake up. They say, no, let's fight this bad thing that is swimming around our blood. You see, this is introduction to allergic reaction. I want everyone to understand. And then in your lungs, in your gut, in your tissues, like, what tissues do you have? Like the liver, the spleen, tissues. There is another guard there, that cells that are called mast cells. That guard there, and when there is another stranger coming in, they wake up. They say, no, let me produce histamine. So these cells produce histamine when you have an reaction. Histamine is formed from the amino acid called histidine. Histidine is when you are exposed to something that is an allergen. And what are allergens? What are allergens, my friends? Allergens are things that stimulate these cells to produce histamine. One, when you go where there is smoke, where someone has a perfume, a very strong perfume, when you go there, now there is this cell that is called mast cell in your lungs, in your tissues. It wakes up. It says that is a bad thing. Whatever you are smelling is a bad thing. It releases a chemical called histamine. And how does it release? Histidine that is in the cell, histidine that is in that cell is exposed to something called histidine decarboxylase that wakes this, because you are an allergy, it wakes up and then you produce something called histamine. All these cells that I've named, they are stimulated like that, my friend. So histidine from protein in food enters the cell. The histidine decarboxylase removes carboxyl group, and then you get histamine and carbon dioxide. That's when you cough. And you know why you are coughing? Because that is what the mast cell wants you to do. It wants you to cough so that you can remove whatever that you are smelling. Another thing, you have said entero, the one that is in your stomach, and the one that is the basophils that are in your blood. When they see there is an allergen, you have taken a drug. You have taken, sorry my guys, I will go slowly. If you are not understanding about allergic reaction, please tell Dr. Benjamin. Tell Benjamin, the wise guy, to go slowly. So when you have taken food that is bad, food that your blood type does not allow, you have a protein that does not need sulfur in it. Michelle lifestyle. How is Michelle, my girl? Hey, my lovely sister here, Michelle. How are you doing, Michelle? How are you feeling, Michelle? We are talking about allergic reactions, and I'm teaching people how to deal with it, but they should know how it has come. So someone told me to talk about hives, but I'm not talking about, I'm talking about allergic reactions in general. You get it? Now, everywhere in your stomach there is enterochromaffin like cell, and then in the blood there is basophil. So when they are stimulated, you have taken a drug, maybe let's say people that are allergic to sulfur. That protein produces sulfur diethylmexoside, or sulfur mixed with something else. And then these cells arise and they see there is bad thing going in your body. So they produce histamine. And the histamine, my friends, is the purpose why you start scratching your body. That histamine is the purpose why you start scratching your body. You get it? So this is the common cause when it comes to allergic reaction. So I have seen many people struggling with, when I eat cheese, my nostril gets stuffy. Cheese, that is Michelle lifestyle. Let me talk about Michelle lifestyle problem. Michelle lifestyle problem. Michelle lifestyle, when she eats cheese, the nose gets stuffy. Cheese is a product of milk. And at the nose, Sorry about that. I'm trying to fix something here. I'm trying to fix something that is disturbing. Trying to fix something that is disturbing. Yes. When Michelle takes cheese, she's having a stuffy nose. There are some immunoglobulins that are around your. This one is a different one. Michelle, I'll explain it to you. Let me continue with this a little bit, Michelle. Let me just continue with this called immunoglobulin G, where histamine release. So I will not forget, Michelle. That one is another pathophysiology, because now you are not getting the real histamine. Now we have continued now about the allergy itself. Now you have produced histamine because somewhere in your body the histamine has been released, because these cells, if you are coming in right now, please just start this video from the start. You will understand more well. When it's released from your skin, the histamine, what it causes, I've explained how histamine come about. Blood vessels dilate and they cause redness, increase permeability around where there is a problem. You get it? And it stimulates the skin and the nerves. So you start feeling like itchiness. That is what people call allergic reactions. So common reactions that cause hives, we know them. Some people eat nuts, eggs, milk, fish, and you find that these foods are not going well with them. They kind of like are stimulating something in their body, some proteins that are stimulated, and the person starts to get an allergic reaction. So when a person starts to get an allergic reaction, you start to scratch yourself because of the histamine that is produced. Because now when histamine is produced to your skin, what is happening? It dilates blood vessels so that you can get oxygen enough. And when you get enough oxygen, uh, at a bit of redness is around where and then you scratch yourself as you release the allergens. Some medications can cause the same. Some insect bites, I know some people here have got some insect bites, and those insect bites has done what? Have caused you to to have an allergic reaction. Eh? Medications, that one I've said. Infections, viral infections. Some people get infections and they swell the whole body. If you have experience of when you eat something and you have a problem, please tell us how you handle it. So, you know, physical triggers are like heat, pressure, exercise, and sunlight. Stress and emotion triggers also. Some people, when they are stressed, they produce some neurotransmitters from the brain, and when they produce the neurotransmitters, it goes to the bloodstream. When it goes to the bloodstream, what do you get? You get an allergic reaction, because basophil, as the cell, is there walking around wanting to know what is going on. You get it? And then there is autoimmune causes. Autoimmune causes of urticaria. Autoimmune urticaria is whereby your cells, some of your cells are attacking mistakenly some of your cells. Those ones, we call them autoimmune urticaria. Some of your cells that are striking some of your cells, and it is very bad. Autoimmune is only managed in the hospital, not at home. You see? So, and there are some others that are called idiopathic. There is no known cause, especially when it is chronic. So, there is types of hives or urticaria or allergic reaction that uh, acute and chronic. Acute lasts less than 6 weeks, often due to an infection or an allergy of food that you've taken. Chronic one lasts for more than 6 weeks, often autoimmune or unknown causes. Sometimes unknown causes, you will never know what has caused the autoimmune. Tulips Corner is here. Hi, Tulips Corner. Missed you so much. Where did you go? Sometimes just come online and tell us, hi, I'm still here. Yes. Yes, yes, yes. So those are the two classes of urticaria. But you know, when you release, you take a lot of, if you are having an allergy of something and then you take a lot of it, you will get some complications. And these complications will be like difficulty in breathing, swelling of the lips, dizziness, and fainting. Some clinical features of hives may be some lumps in your skin, scratching yourself everywhere. You've seen that picture that I've placed there. Let me put it again. Now, let me put it at a big screen like that. Like that. Look at that picture. That picture shows you an urticaria. That is what I mean about an allergic reaction. You see that picture? That is what I talk about, urticaria, allergic reaction. So, you will find that these are features that come about when you have these problems. If you have ever had an allergic reaction, please tell me. We see how we can help you. But the help of allergic reaction, we will see it is very fun, manageable when sometimes you cannot manage and heal it, but you can manage it and will heal well. So there are some uh, medications you can use. We will talk about that, and some triggers that come across when you have these problems. I don't want to go deep into the medical part because the cells have some specific medical issues. I just want us to know how you can help yourself when you have hives. When you have hives, you will have some problems, and yes, let me check this out. Other types of sensitivity types, cytotoxics. Okay, that one is important. Now, you can there are so many triggers that you can have allergies of: food, gases, cotton. Most of the time, let me say this, when you have these problems, they are not treated. But if you have an allergic reaction because of a drug that you've taken, the only way to be good is to avoid it. And that's why when you go to a hospital, a doctor will always, number 6 done. Oh, number 6, tulips. Tulips is number 6, guys. Number 6 on the WhatsApp group. So when the time comes for her, be ready to make tulips smile. Let's make tulips smile. Smile, and one day she'll smile to the bank. Tulips is number 6. Yes. We continue. So when you have an allergic reaction, let's say like you are using a drug and then it's giving you allergic reaction, it depends with severity. It depends with severity. If it's so severe, go to the hospital. If it is mild, use drugs like corticosteroids like prednisolone, use drugs like steroids like antihistamine like cetirizine, injections like we in the hospital we use hydrocortisone. So hydrocortisone, what it does, it makes you be relieved. It makes your the histamine thus not to be released either in your blood, in your Margaret in Norway. Welcome, my sister. But you have not posted your channel. Post your channel here. People want to follow you. You know, after some time, these videos of mine, people watch them daily. And because they are medical, someone has an allergic reaction, comes and watch. And maybe can see you posted your channel here, and then the person follows you. and it becomes a good thing in future, you gaining people, followers, and us enjoying. Yes. Now, if it is mild, use oral medication like antihistamines. And I'm saying there will never be a drug to treat allergic reaction. Immunity mediated problems, they, as you grow, they decrease in sensitivity. You get it? So there are some people who have seen, who have protein allergies, and if there is someone who knows about this, please, I want you to tell me if it is true. If it is true, there are some people that have had, and they say they had allergy of protein for so long, and they went to a certain doctor at the village somewhere, and they were given some drinks, and right now the person is taking meat and meat products so well. Please, if you know that plant that people uses, give me that plant so that I can go do the research, and then I'll come with a drug to heal allergic reactions. Allergic reactions, the way I have explained, you see, they only come because of a reaction of a histamine reaction, and the only thing that you usually do is this: you always make the histamines to slow down up until the reaction has gone out of the body. Your liver has metabolized what you have taken, converted it into water soluble, removed it by excretion from the kidney. As you take the histamines, they are reducing the antihistamines, they are reducing the allergic reaction by not giving you more histamine as you wait as the body is removing it from the body. So if there is someone here who knows a person who has ever got that drug to heal allergic reaction, I want you to tell me. I want you to tell me so that we can help each other to 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 go on and produce a drug. Now, how can you manage? How can you manage allergic reactions? How can you manage allergic reactions? Allergic reactions are not treated, they are managed. Hmm? General principles in management of allergic reaction is: determine the severity. Is it mild, moderate, or severe? Severe is when you have an anaphylactic reaction and you even pass out because of allergic reaction. Michelle Lifestyle, I've not forgot your point. I'll go back and tell you. Management of mild allergic reaction. The first line drugs. Go to the pharmacy, get cetirizine, loratadine, chlorpheniramine. All these drugs stops that chemical from coming out so that you cannot get the side effects of allergic reaction. Calamine lotion and some lotions that you apply like betamethasone, they help block H1 receptor, it reduces the histamine gas like itchiness and swelling. Moderate allergic reaction like urticaria, you can use prednisolone or hydrocortisone or salbutamol. But severe allergic reaction, you have to go to hospital and they will follow the steps. They will give you some inhalers, some injections, oxygen, IV fluids, antihistamines, all those. And then long term, you avoid triggers. Like if you are a person who suffers from allergic reactions every time, avoid triggers. Avoid things that are giving you these allergic reactions. You get it. Hmm? You get it. So in that is the simple thing. It is not so complicated. Hope Campbell, how are you all? Hope Thanks for being here. We are talking about allergic reaction. Now, before I go, because it was a short session, if you have a question, just ask. I will be here waiting. Let me answer Michelle Lifestyle. Michelle Lifestyle, there is another allergic reaction which I don't want to talk about it right now. It is not about the histamine. That one I will explain shortly, then the day will come. There are some type 2 immunoglobulins. Those are cells of your body that fight some other things that are enemies of your body. So in around your nose, we have got some things called IgG and IgM. And these are the things that when you eat something, you can cough, or you smell something, you can cough. There is something called type 2 and type 3 immune complex. Type 2 is called cytotoxic. Type 3 is called immune complex, antigen antibody complex deposit in tissues. So when you take something, you start finding if the effect of this cell, like type 3, is undergoing, you will swell. I don't know if I'm being Vini Oyugi. Hey Vini, how is you, Baba? I can see you here. I'm trying to explain in a simple language, but it's becoming so hard. But I'll bring, because it needs a session, Michelle. Just try and understand what I'm talking about. We have type 2, which is cytotoxic. It kills some cells. Type 3, it is called antigen antibody complex deposits in tissues. And type 4, delayed T cell mediated no Ig, occurs between 24 to 72 hours. That one is in the skin. And then an Ig mediated Hives. Now, when you take food on the road, in the back, yes. Thanks, Betty's World. Betty's World. I have to add you on a group. I'm trying to find your WhatsApp group or WhatsApp number, but I'm not getting it. Please pin me on any of my videos. Please pin me on any of my videos. So when you take food, the IgE, immunoglobulin E, is a protein. It comes out. And you have said you are taking, when you take cheese, that is a product of a protein. The immunoglobulin E comes out. And what it does, you start having stuffy nose and running nose. You get it? There is immunoglobulin G, which is, these are proteins that are in our bodies, that this protein is around your nose. So when you take cheese, your body mistakenly thinks it is a bad thing. And then you start having stuffy nose. You get it? But I'll talk about immunoglobulins. Don't worry, a video is coming on immunoglobulins. It needs me to go step by step about immunoglobulins and tell you these are proteins that cover your immunity. Now, these proteins that cover your immunity, IgA, main protective antibody in the nose. It protects you from bad things around the nose. You see? And then we have another one called IgE. Causes allergic reaction in your nose. And then we have IgG. General immune support, less important locally. So the ones that makes our friend, our good girl Michelle have stuffy nose, those that makes someone have stuffy nose are those two, IgE and IgG. So when Uh, our friend Michelle Lifestyle takes cheese. IGE mistakenly does what? Thinks it's a bad thing. So she starts having rhinitis as protective measures. But I will talk about immunoglobulins. That is another thing when it comes to blessing to you, Dr. Ben, and everyone in chat. Yes, Uncle, please do run a video for us tomorrow. We have just talked and you are busy. Uncle is busy. If you have time, please check out Uncle. Check out Tulip's Corner. Check out Margaret in Norway. Check out Gabriel. All these people that are here. If you have a time, they are doing, even emphasis. They are doing great work. So that is all about allergic reactions today, my friends, my guys, my people. If you have a question, please raise it out. If you have a question, I'm giving some time for anyone to ask a question. Please, anyone to have a question, please. Before I go, I feel so hungry. I've not eaten till morning and it is going to 11. I think I have to find something to drink. At least I freshen up before midnight. And I have to wake up early tomorrow. And if I'm feeling I can start getting. I'm waiting for any question. Any question? Anyone who has a question, please. Anyone who has a question? Let me give 2 minutes for questions if there is anyone who has a question. But Michelle, I think I've tried to answer your question in layman's language, but that it needs like 1 hour to explain what to clean the blood. Hey, Betty's one. That one. Betty's one is asking how to clean the blood. Betty's one. When you have dirty blood, that means you have an infection in your blood. And any infections that is in the blood, it is called septicemia. It is a very bad state. Let me tell you one thing. There is nothing like blood cleaning. If you have anything in your blood that is bad, your body will respond so fast. Your body will respond so fast and you will see you are sick. Imagine blood that is circulating, your blood having problems and it's going up to the brain. You'll have problems. So there is nothing like let me clean blood, because when you eat any substance in your body, it goes to your liver. Your liver destroyed that thing into from fat soluble to water soluble. Then it divides those chemicals so that when it is going to the kidney to be excreted, the kidney only takes what the body needs and balances the sodium, phosphorus, the potassium, all those, so that by the time your blood is going through your brain, is going through your tissues, it is very clean. Your late dad used to be done dialysis, cleaning blood, and that is what I'm explaining. Vincent Oyugi, dialysis means your kidneys are not able to sieve your blood, so we are doing them artificially. So if you are healthy and you are eating well, your kidneys are good. Just take enough fruits, antioxidants, and take enough fruits are called antioxidants. Take enough fruits that are antioxidants and take enough water. Don't overdo fatty foods. Don't overdo carbohydrates, because more glucose turns to glycogen, and then after more glycogen in your liver, you start getting triglycerides, cholesterols, mostly in your body. That's why when you eat more starch, those people in Kenya that we eat more ugali and we don't do exercise, you find that you're starting to have more big, 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 and that one is not healthy. So, Vincent Oyugi, dialysis is done to balance the electrolytes. In medicine, we don't call it cleaning blood. We call it balancing of electrolytes so that your body can continue doing normal works. So, my friend Betty's World, what to clean the blood is from today at least you know there is nothing like cleaning the blood. You just need to eat well, take enough fruits. Maybe I may say fruits are good and vegetables because they are called antioxidants. They remove something called, hey, my friend J. King Ray in the house. King Ray, welcome. They remove some things called free radicals from your body, and these free radicals may cause destruction of tissues, and free radicals bring cancer, and they make you feel sick. So but when it comes to diseases like pathogens and that, if you have any pathogen like a bacteria in your blood circulating, you will be in bed sleeping and very sick, not feeling yourself. Because the blood that you have, and you see we do blood culture, you find a lot of bacteria. It goes to your brain, you will not function. So septicemia is a very bad disease of the blood that is infected, that makes people be admitted in court. So for me, I will say, let's just pray God, and let's live a healthy life by eating fruits, because fruits are antioxidants. They make us stay away from cancers, and they make our blood strong, and we live well. So I think Betty's World, I've tried to explain that the kidney does all its work. So if you have a healthy kidney, I don't see the need of trying to take some concussions in the name of cleaning blood. Can I have a last question before I go, my friends? Please, a last question. If anyone has any last question, I appreciate everyone, my friends. Just give me a last question. But Betty's World, please share your number. There is a group that I really want you to join. Or if you can give anyone who has Jamaican numbers, uncle, if you have Jamaican uncle number, text Jamaican uncle's WhatsApp, we will add you. Any last question? I really want to go and eat something right now. My head is paining. So if there is no question, we meet tomorrow as we continue with the topic of, I come online at around 16 hours and 4:30 in the evening for a Kenyan time. I'm always online that time to answer questions and talk about the topic of the day. 16:30 in Kenyan time. And if there is a request for me to talk about something, this is the time I come, because of right now I'm in the hospital. There is no lots of patients. Some are sleeping, and unless there is an emergency. So if there is a request, I do request at night here. Here it's 10:55. It's going to right now. It's going to 11 at night. So thank you so much for those who have tuned in. I think I've tried to answer a question to satisfaction. If you are not satisfied, email me, we talk. You email me, we talk, and we meet tomorrow, please. If you are in the in the tropical countries of Africa and East Africa or South Africa, please have a lovely night. Sleep tight. We meet tomorrow, and be blessed, everyone, for your support. Bye. Betty's World. Remember.